Come on, daylight's burning. How are you? I'm going to take your hat next time. Okay. Good morning to everyone. I'd like to acknowledge my colleagues who are here with me today. To my left, you'll hear from him in a moment, Michael Dowling from Northwell Health, which has done just a fantastic job, not just at this facility, but all across the state, and I want to thank him very much. We have John Cohen, who's the executive chairman of BioReference, which is a private laboratory which is going to be working with the state of New York and tremendously increase our capacity. I want to thank John for his professionalism and for the way his company has stepped up. Mike Copey, who's our Director of Emergency Management, and his entire team, which has been doing a great job, and Simonita Sabotic, who works with me in my office and has been coordinating much of this response. We're in New Rochelle this morning. New Rochelle has the highest cluster of coronavirus cases in the country, the highest density of cases. We made New Rochelle what we call a containment zone, which means we closed the schools, we closed the large gatherings, and we brought in the National Guard to help the community. The National Guard has been helping clean, they've been distributing meals, and they've really done an outstanding job, and I want to thank them very much. They're here today. Thank you for the beautiful job. Let's give them a round of applause. As you know, our strategy in this state, what communities all across the country are trying to do is slow the spread of the virus. There are two ways to do that. First, reduce density. Reduce the concentration of people, so you reduce literally the likelihood of communicating the disease. We announced yesterday we're reducing large gatherings. That's all density reduction. The second leg of the strategy is testing. Testing, testing, testing. You want to find positive cases because you want to be able to isolate those positive cases and then find out who that person may have been in touch with so you can get them the assistance they need. This is a very creative way of testing. This is drive-through testing, something I didn't hear of last week, but something that we're doing this week, thanks to the good efforts of the team we have here. Drive-through testing means people in this community can call a telephone number, make an appointment, and they can come to be tested and literally drive through the testing facilities. There are 6 lanes that are operating. You drive in your car, and the medical staff comes to you, does the test, takes the swabs, and then you pull out. The swabs get sent to a laboratory, in this case, BioReference. They do the testing, we get the results back to the person. This facility can do about 200 cars per day. So depending on how many people are in the car is how many people you will actually serve. It's not only faster and easier, it's also smarter and safer because you're not exposing people to a person who may be positive. Up until now, if somebody thinks they're positive, they might walk into a hospital. They walk into a hospital, they're now exposing people in the emergency room, they're exposing staff, etc. So it's actually safer to keep them in their car so they can come in for the testing. It's less exposure overall. We have a phone number. You can't just come. You have to call first, make an appointment, and then come. Each car is here for about 15 minutes. The phone number is 888-364-3065. We are prioritizing people in New Rochelle first, because again, that's where we want to reduce that density and reduce those cases. But people from all throughout Westchester can be served at this facility. We are also prioritizing vulnerable populations, and this is what we have to keep in mind. Many people will be exposed to this virus. Many people have already been exposed to this virus, didn't know it, and have what they call self-resolved, where they had the virus, they thought they had the flu, they're now better, they may have had mild symptoms. So many people have already been exposed to the virus, and 80% of the people will self-resolve. Our priority, because our concern is the quote-unquote vulnerable population, and we have to keep that in mind. Senior citizens, people with compromised immune systems, and people with underlying illnesses, especially respiratory illnesses. This is basically pneumonia. And if you have an underlying respiratory illness, then the situation is more problematic. For 80% of the people, you'll self-resolve, God bless. We're focusing on the vulnerable populations, and we need to keep that in mind. This facility is new and different. I understand that, but our job is to find ways to respond to the situation, and this is a new situation, so by definition, you're going to see new and different responses to it, and that's what you're seeing here. I spoke to Vice President Pence again yesterday, and I want to thank the Vice President, who's been very accessible and very cooperative. On the issue of testing, I said to the Vice President, and I've said publicly, I think the federal government should decentralize testing. What does that mean? Rather than trying to control it all through Washington, through CDC, and through the FDA, the volume is just too high. States regularly regulate labs. We have 200 private labs in the state of New York. Those laboratories are doing HIV testing, Zika testing. They're doing all sorts of testing for us. Our State Department of Health routinely regulates those 200 labs. Let the federal government decentralize the authority to the state governments and say to the state governments, God bless you, you can go authorize testing. You can authorize what's called automated testing, which takes a lab capacity from like 30 tests a day to like 1,000 tests per day. But we do have a crisis in testing. We're not up to scale. You need to change that quickly and let the federal government turn that function over to the states. The states do it anyway. That's our bread and butter. You could open up 500, 1,000 laboratories overnight if you just turn that responsibility back to the state. I hope the federal government takes this recommendation seriously. I know that in New York, we have dozens of laboratories that could start testing tomorrow and could increase their capacity dramatically if we left it up to the state regulatory bodies. I also, in closing, I want to say a special thank you to the healthcare professionals who are here. These nurses, these doctors, they get into this line of work because they have a calling and they have a passion to help other people, as simple but as profound as that is. And there's no finer demonstration of that than what you're seeing today. People who come here to help other people, put themselves in a precarious position just to help other people. It says something about who they are, it says something about their character, and it says something about their heart and their soul that is just truly beautiful, which I respect and I admire, and I am very grateful for. So I thank each and every one of them, not just here at this facility, but all across the state, who are in emergency rooms today and laboratories today, who are really stepping up to help their brothers and sisters. It's humanity at its best. You know, at times of crisis, we tend to see what people are really made of. And you see the good and you see the bad. But today, the people who are working here are showing us the best. And I truly respect them and I thank them all. To BioReference and Mr. Cohen, we'll have a capacity starting next forward, and I want to thank them very much. And Northwell and Michael Dowling, who I've had the pleasure of working with for many years. Michael Dowling used to work for a person who I consider the greatest governor in the history of the state of New York, a gentleman by the name of Governor Mario Cuomo, who had Michael as his health commissioner and head of health for the entire state. And my father was a great judge of character and a great judge of talent, as evidenced by Michael Dowling. I give you Michael Dowling. Thank you.
Thank you very much. Thank you, Governor, for being here, and thank you also for your extraordinary leadership during this time and this crisis. You have your daily briefings and press conferences, and your actions demonstrate leadership at its best. You've been practical, focused, humane, entrepreneurial, also trying to calm down the public, because anxiety and fear is also one of the issues that we have to deal with on a continuing basis, and that's, I think, a responsibility of everybody, including the media. We have to deal with the issue, but we also have to deal with the issue of anxiety, the virus itself, plus the anxiety that surrounds it. And this is a unique facility, and again, this shows that the entrepreneurship that we have here in New York of being able to do something that I don't think currently exists any place around at the moment. But a facility like this is unique, and the vision of the governor to create this is pretty extraordinary. And CEO of Northwell, I am delighted to be a partner with the governor on this. And at this time, it's important for all of us to be partnering together, the public, the private labs like John Cohen's facilities, and all of the other entities out there around the region working together. This is a time for unity, not division. This is a time for us to think of community at large. And I am a very strong believer, as the governor has indicated many times in the past, that we are going through a lot of inconvenience, but this is an issue that will be beaten. We will win this. It may take some time, but we need a dose of optimism along with practicality as we deal with these issues. And I again also want to reiterate what the governor just mentioned, and that is the staff that are involved in this, including the staff that are here, but also the staff that are in all the facilities across the state. We have a wonderful healthcare system in New York State, and the staff are on the front lines each and every day, also having some anxiety as well, but coming to work, doing the thing that they need to be doing, and taking care of the public. And it's amazing that at a time like this, where healthcare is on the front lines across the board, and the public should, and politicians who sometimes criticize healthcare should realize that at a time like this is when healthcare is needed the most. At Northwell, we have a phrase that we use, which was a phrase that was developed by the staff, which basically said, we're made for this. And so we are made for this. The state is made for this. We will deal with this issue practically. We will win. And with the leadership of Governor Cuomo, I have no doubt that we will be in the front lines of innovation, creativity, and eventually succeed. So, Governor, thank you for being here. It's a pleasure.
Thank you. Thank you, Michael Dowling. New York is made for this. New York is a place of challenges. We meet them and we overcome. And Michael's exactly right. We're going to do that again here. Questions?
How long do you anticipate this facility being open, and how many is prepared to have any testing or anything like that? I mean, I know there's a priority, but down the line, before we're not testing.
Two parts to your question. First, how long? This facility will be open as long as it needs to be open. It will be open for the trajectory of the disease. I don't believe that this is going to be a short-term issue. I think we're looking at a matter of months, and people should start to calibrate that into their expectation. I think this could be a 6, 7, 8, 9-month affair, watching the trajectory of the virus. So I think people should start to recognize that. This is not going to be over in 30 days. It's not going to be over in a couple of weeks. There'll be waves. It'll go a little higher, a little slower, but it's going to be a somewhat prolonged situation, and we should be ready for that. The testing, this country is behind on testing. Everybody knows that. The question is, for me, I'm not big on lamenting about yesterday, right? We live in today and we plan for tomorrow. So how do we quickly bring testing up to where it needs to be? And what I'm saying to the federal government is let New York do its thing. We have the ability to bring on dozens of laboratories, increase by several thousand in a matter of a week our testing capacity if the federal government just decentralizes the authority to the states. As I said, I had a good conversation with the Vice President. I think he heard me, and he said he would get back, and I'm hoping for a favorable response. They call the telephone number that I gave you. They make an appointment, and they come here by car. Once they have an appointment, they drive right in. There are 6 lanes, and you get tested right in the car. You don't expose anyone else, and then you go back home, and they call you with the results. It's prioritized for people in New Rochelle. It's open to all people in Westchester County, but priority New Rochelle and priority vulnerable populations, because that's what this is all about, my friends. This is about senior citizens, a vulnerable population, people with existing respiratory illnesses. This is about nursing homes, senior-assisted facilities. That's really the focus. I know everybody is anxious. Michael's exactly right. You look at the news, you get anxious. 80%. Look at the numbers. We have facts. We have facts where this virus has been tracked since the first case in China. Johns Hopkins does daily numbers. Over 120,000 cases. We know just how many people have had the virus, how many people have recovered. So if you know the facts defeat fear in this case. I understand the anxiety, but we also have to be realistic about what we're dealing with. We've been more aggressive about utilizing state testing capacity, but we can't do more than the federal government allows us to do. We do have tremendous testing capacity if we're liberated by the federal government. As I said, we have 200 laboratories in New York, right? Our State Department of Health regulates them now, does business with them now. When you go for a blood test for whatever reason, you go to one of those laboratories, it's regulated by the state of New York. Let us use that mechanism and open up that mechanism to do these tests. This is not a complicated test, by the way. It's a virus test. We have many labs with this capacity. Thus far, the federal government has been controlling the testing. We want the state to be able to control it. Let us use our labs. Let us get the capacity up. We do have a prioritization of tests. You know, if you just said, tomorrow, anybody who wants a test can have a test, you would have a line that went around the state, right? Everybody is so anxious. Let me get a test and find out. So we prioritize who can get a test first to bring some rationality to the system. But we'll have thousands of tests available next week. If the federal government heeds our plea and lets us actually turn on our capacity and use our state assets, we could have many, many more.
Governor, the superintendents of Westchester, Putnam, and Rockland County say they're looking to use your office of guidance on school closures. They say right now they're not getting that guidance. They're making the decision one by one. They want you to close the schools. What's your response to that?
They have our guidance. Our guidance is this: if you have a child who tests positive in your school, the school must close for 24 hours so we can disinfect the entire school. And then during that 24-hour period, we will talk to that local school district, find out the facts and circumstances, and make a decision. Any superintendent can decide to close their schools. Many have. It's a local decision. It's not a state decision. The only mandate we have is if you have a positive child, you must close for 24 hours. But you have many school districts that are closing for one reason or another. To do mass closings of schools is not without consequence. Schools also run food programs for many students. You close schools, now what do you do with those children who are home all day? You close schools, you now have parents who can't go to work. You have parents who are working in healthcare facilities who can't go to work. So it's not that easy.
Governor, I'm a resident of Rochelle, and I know that many of my neighbors who are not showing symptoms would like to be tested. Can someone explain why, if you're not showing symptoms, testing you just doesn't make sense?
You are much, much, much less contagious if you are not showing symptoms, right? And what this testing is all about is identifying the person who is positive, because that person could spread the disease. You spread it when you have symptoms. You spread it because you sneeze, because you cough, and it's on your hand, and then you put it on the countertop. You cough, and other people breathe in the droplets. If you are not showing symptoms, in all probability, you are not contagious. There's always the exception to every rule, by the way. But as a general rule, that is true. So if you have to prioritize, you want to prioritize people who are showing symptoms. That's just common sense.
Is there also an element of the viral load in your system that won't trigger a positive until you reach a certain level? Is that part of what it is as well?
That I don't know. That I don't know. That is above our pay grades.
Governor, a lot of these testing centers are modeled differently. Every country's taking their own approaches. Has this one been modeled after the approach of a certain country or region?
This is the New York model. Easterly exposure, no. I think everyone designs a model that works for them and their location, and this was designed for this location. The testing itself is relatively straightforward. You know, the swabs are relatively straightforward, and the testing is straightforward. The problem, the logjam in the quote-unquote testing, has not been the testing kits. You know, when you hear the federal government say, we've sent out millions of testing kits. The testing kit is the swabs, right? And the container that the swabs go in. There are plenty of testing kits. The problem has been there are no labs to do the tests, no labs that were authorized by the federal government, no labs that were allowed what's called automated testing. Automated testing is just what it sounds like. It's manual versus automated testing. Manual testing, Northwell can do about 30 tests per day. Automated, they can do about 1,000 tests per day. So that's the issue on the testing.
Governor, how long will you get to test yourselves back?
At this facility, do we know? 24 to 48 hours.
Last question, guys.
On the order of the mass gatherings, we get questions. Does that apply to housing commercial?
Yes.
That routinely
Yes.
over 500?
Yes. Yes. Look, and again, it's common sense, right? What did we do in New Rochelle? We did close the schools, and we did limit gatherings before we put in effect the rules yesterday. Limit the mass gatherings because that's where it is going to transfer. And you want to reduce the spread, you want to reduce the transfer. I know it's inconvenient. I've had many people make that point to me very loudly. But better we inconvenience ourselves, better we take the necessary measures now, we try to reduce the rate of spread, because at the end of the day, we're trying to make the spread of the disease a rate that our healthcare system can accommodate. That's what this is all about. And again, mostly for vulnerable people. I just want to, I get the anxiety. This is like a science fiction movie, right? Virus spreading. I get it. But you can't disregard facts and data. And that has to be factored in. Yes, this is going to be inconvenient. Yes, people are anxious. But that's New York at its best. That's the challenge we rise to. We need a level of consideration in how we conduct ourselves, a level of consideration in how we treat one another. We have to understand this is not quick, this is not short term. We have to settle in for a somewhat long ride. But I have no doubt that at the end of the day, we will be through this, and we will be the stronger and the better for it, just like every other situation that we have gone through. Thank you. God bless you. Thank you. It has started. Those cars online are getting tested.
Are there any more facilities planned around the state?
Right now, just we're focused